most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about the 6 big lies about hip pain, hip arthritis, and surgery. These are common statements that Brad and I have heard over, 50-some years of treatment?
Combined.
Combined, yeah.
Right.
Not 50 alone. But we hear these commonly occurring themes. And so we're going to address that. So hip pain obviously can occur at any age, you know, if you have like a sporting injury or you have trauma. But as we age, it actually can show up for no reason whatsoever. I mean, all of a sudden, you know, you're 50, 60, 70 years old.
Right.
All of a sudden it pops up one day.
Right, right. But, you know, it can go away, too.
Yeah, it can go away, too.
And so that's what we're going to address a little bit here.
Yeah, so we're going to talk about the typical scenarios. So someone goes in, they're 50, 60, 70, they go into the doctor, they're having hip pain, just started on its own. First thing the doctor's going to do, maybe an x-ray, MRI, CAT scan. Not the first thing, but maybe, depending on the doctor.
Right.
But eventually what they're going to show, you're going to see these results of these scans, and it's going to say there's degeneration and osteoarthritis in your hip. It might be bone on bone even.
Right.
And you're going to, oh my gosh, now I know what's causing my pain. So they're going to do medications, injections, and maybe even surgery.
Sure.
But what we have found is that, and study after study has shown this, is that it's really osteoarthritis degeneration is just part of the normal aging process.
It's like getting gray hair.
Yeah.
There are some things that may increase it. For example, maybe some muscle tightness around the joint is making it worse. And if we can loosen those muscles up, the pain can decrease and actually improve things.
Exactly. So it's not necessarily what you're seeing is the problem, because the studies they've done is they looked at people with no hip pain, did x-rays or MRIs on them, and they found lots of these same things.
Right.
They found, and the other thing, Brad, I'm sure you've seen this a million times. Somebody comes in and they're going to need surgery on both knees, but they're doing it on the one that looks better to start off because that one hurts more.
As far as
surgery first,
X-rays.
Yeah, they had X-rays of both knees.
Right.
They're both bad, but one really, really hurts, and that's the one they're going to do surgery on. And that one doesn't look as bad as the other one.
Right.
So I mean,
the X-rays and the pain level, they don't always
match,
add up, you know.
Right.
And it's just.
And that, I bet you right now we could do an X-ray of our hips, Brad, and I bet you they'd find stuff.
Oh yeah.
I know they would.
All right. And I want to say that you know, 2 episodes, and I worked with you on both of them. I had severe hip pain where I had to use crutches. And I thought, boy, maybe I better go in and get this x-rayed. And I didn't. And both times within 3 days, hip pain got better. And actually, it went back to complete normal.
And it probably helps that Brad's a therapist because he knew what to do as far as calming the pain down.
Yep.
And also, you know, that's the part of this whole, this video, by the way, is a part of a series of videos on hip pain. If you go to bobandbrad.com, go to the program section, we look for the one on hip pain, and we got a whole series of videos, and you can look through them, pick out the ones you want to watch, but they're going to tell you what to do to calm your hip down, and not possibly take the pain away.
Sometimes it stretches, sometimes it may be
strengthening,
heat or ice or strengthening, and they're all about 10 minutes long.
Yeah, might be poor daily habits,
right?
And hip inactivity too, if you're not moving your hip enough. So,
and another big one here, I don't know if we have that on the list, Bob. Oftentimes you can get pain here in the hip, and we find out it's from the back.
Right.
A referral pain, which, you know, even doctors can get that mixed up. It can be tricky. The human body with referral pain can be a tough.
For those of you who are listening on the podcast, he was pointing to his back and the back of the hip there. So, all right, the second lie. If you have arthritis, it's going to just get progressively worse. That's not necessarily true. They've done studies and they've done scans of people, and you know, a couple years later, and sometimes it's no worse, and sometimes it even gets slightly better.
Right,
So,
and maybe if your activity level improves,
yes,
and the pain goes down, that's That's what we're looking for. Even if the X-rays didn't show it got better, but you can move better and you're feeling better. You know, that's where we're that's where the bread and butter is.
And my wife doesn't like when I mention her, but she is an example here. I'm not even tell you her age, 56. When she was 54, her knee.
I remember
fired up, and it got so bad she was on crutches. She thought she's going in for surgery. I was like, oh, you better, you know, she couldn't even walk. I mean, not even think about running because she was
using a cane or a crutch.
She was using 2 crutches first, then she went to 1 crutch.
Sure.
But we worked on it, and she's back. She ran like 3-4 miles this morning.
Really?
Yep, she's been running.
Yep.
No pain. It's just awesome.
I suppose running away from you.
Yeah, it's a motivation. So, number 3 lie is I wore out my hip because all my life I've been running or hiking or roofing. I hear a lot of farmers say because I wore out my knees because I was milking.
Right, right.
So, and in that case, it might be actually true.
Well, especially on those concrete surface as well.
But actually, it's not true as far as running or hiking because active people have better joints.
Right.
If you're using the joint, it's going to be actually healthier than if you increase that synovial fluid, you increase the blood flow to the area. It's the inactive people or sedentary people that start having hip problems and arthritis that doesn't go away easy.
And there's always exceptions, but as a rule, people who move more within reason, of course, and not doing excessive, extreme things, the body likes it. It adapts to it. It's healthier all the way around.
Number 4, I don't want to make it worse, so I'm going to rest it. Now, that is okay to some extent, but people rest it too long, or we like the fact that if you can take some of the hip off, some of the weight off the knee, the hip, it can actually maybe decrease the pain for a while and calm it down.
So a good example is you have hip pain when you walk or when you stand. So, it's your body's telling you, just don't stand, don't walk. So what you can do is alternative, possibly a good alternative that's not very practical for a lot of people is swimming.
Right.
But who has a pool or access to it. So a stationary bike may be a nice non-weight bearing
but
motion.
You're still moving the hip.
Yep.
But and you can even do lie on your back and bring your knees up and rotate them back and forth.
Sure.
And that even gets a little movement in your hip.
Right. And we do have a number of these videos. We'll show you
motions how to treat.
You can do without stressing the hip with weight bearing.
Number 5 lie. My mom had arthritis, so I'm pretty much destined to have it too. And the fact is,
that's a possibility.
It's a possibility,
but when you do that, it kind of pre-programs you, and it's like you're
I'm destined to have arthritis no matter what I do, and the fact is, almost everybody gets some arthritis at some point.
Right.
And your lifestyle and exercise are more important than the heredity factor.
Sure.
So if you can go ahead and do the things that we're going to recommend in these upcoming videos, you can help knock the pain down or keep it down.
Exactly. As a matter
go ahead, Brad.
Well, I was just going to say, I'm reading a book right now about a woman who teaches Pilates and other motions, and she focuses it around, works with people specifically with pain in their joints.
Oh, sure.
And the whole concept of keeping moving, doing the right motions that don't irritate it.
We're reading some of the same books, Brad, because I'm doing the same thing right now, too. It's always about motion.
Right. Keeping things moving with proper motion that doesn't irritate it, which isn't always easy to find for some people, but you gotta look for it, and that's why therapists are here, and that's why she's there. But and that's why we have our videos to help you out find those.
Yeah, because it can make a big difference in your life, especially if you're having some chronic pain.
Yep, exactly.
Number 6, the final big lie. I'm going to need a hip replacement anyway, so I might as well have it now. Now, first off, it may not be true that you're going to need a hip replacement.
Right.
Again, we talked about the arthritis possibly could, stall out and not get worse.
Yep.
And if you do some of the exercises, the stretches, the strengthening, and proper habits, you may never need one.
Right. I do want to mention, they might say, well, I saw my orthopedic surgeon, and he says that hip needs a replacement. And that may be. However, if you go to another orthopedic doctor, he might say, Well, I've seen a number of hips like this, and had some therapy, and they were able to get away without it. So a second opinion can also be very helpful.
And, you know, if you have a hip replacement when you're too young, obviously they wear out.
Right, the replacement does.
Yeah, and you could end up having to have another one, you know, in 15, 20 years. And so you want to delay it as much as you can, if you can, and as long as you're healthy. I mean,
right, because if you get one at 45 years old, and say if it lasts 20 years, you're 65, and that's called a revision when they redo it. Any surgeon will tell you that it's much harder to do a revision because you got the old hardware you have to remove. Yeah, it's a big challenge, and they like to avoid that. So
when you're 45, 65 seems like a long time away, but it's not. Believe me.
It comes around pretty quick.
So, okay, again, check out the program on hip pain, and each program or each video has a
PDF printout, and it prints out the highlights of the exercises so that you can review that, and then you don't have to go back and look at our faces. You can actually just, you know, see
well,
things.
If you want to go back and look at our faces.
Well, yeah, you can, but, you know, I understand if you don't.
All right, that's why podcasts are nice. You don't have to look at us all. All right, thanks for watching.